There. Got it. Awesome. This is why I make notes for myself. And so this is being recorded, and then later this month, it will be on the IPHA YouTube channel. So obviously, housekeeping rules, we always have those. Make sure that your microphone is muted during the presentation. But at some point, I know that the lovely ladies that are presenting would love some interaction and would love for you to ask your questions. So at some point during the presentation, please unmute yourself, raise your hand, or ask some questions, because we really want this to be an interactive and beneficial lunch and learn for you all. Today, our speakers are from the University of Iowa College of Public Health Student Strike Force. There's, a handful of them. So I am not going to introduce them. I'm going to let them introduce themselves. I will also turn my camera off so that I can support the bandwidth, but I will be monitoring the chat. And let's hear from our lovely ladies at the U of I.
Bonnie, you want to go first? Yep.
And just to let everybody know, there's two Bonnies on this presentation. So sometimes there might be pauses because we're not really sure which Bonnie is supposed to do whatever. So it's always interesting. And to also let you know, if you hear some little voices behind me in the background, I'm helping my nephew and his wife, who are both doctors, who had patients today, but they did not have daycare. So we have little Elise and little Anna Marie here, so you might just hear them every once in a while. We're really happy to be here today. We want to talk to you about the student strike force here at the College of Public Health and other things related to the grant that this is under. It's under a grant from IPHA called the Workforce Development Grant. Tricia and I are both working together on the strike force part of it. Bonnie Butler is here today because she's working on the internships opportunities, which we really hope you hear about and can participate in. And we also invited Mary Skopek and Jess Wagner because we have worked with both of them when it comes to the strike force and our activities. Tricia, do you want to go ahead and talk to this slide about the Public Health Workforce Initiative?
Okay, sorry about that. Yes, so the strike force and the work that we're doing really has come underneath the grant that we got with the College of Public Health has with the Iowa Department of Public Health. And so basically there's a couple prongs with the grant that we received. It's training and education for new and existing public health topics. It's working with a workforce development coalition. It's working with 3 public health departments as academic public health partnerships, and that is Blackhawk County, Lynn County, and Johnson County. It is working with the strike force, which includes the work that Bonnie Rubin, sorry, I'm always going to say Butler first because of the alphabetical order. So Bonnie Rubin and I get to lead the strike force and work with the students in soliciting them to join our team, but then also working with our community partners, local public health agencies, and nonprofits across the state of Iowa to get them involved and actively participating in initiatives that is over capacity of what the health department or organization can handle. And then we've got the enhanced student learning opportunities, which Bonnie Butler will go into more details about. I'm going to go to the next slide. If it will let me, there we go. Bonnie, I'll turn it over to you if you want to talk through a little bit of the experiential learning.
Sure, I'm Bonnie Butler. I'm the internship program coordinator. Previously, I was at Cedar County Public Health for 6 years as the tobacco prevention coordinator, and then for 10 years as the Public Health and Emergency Preparedness Division manager. I began this position in January, and it's been really exciting to try to integrate some more learning opportunities for our students. So, oops, Tricia, can you put that back up?
Sorry about that. Give me one
That's
second.
okay. So there are several different ways that our students can learn about local public health projects. We used to really focus more on just those projects that were required for their graduation for the undergrads and the graduate students, but we've tried really hard to extend those so that we can give them some more opportunities. They're really hungry for all the knowledge that they can get. They really want to be boots on the ground and know what local public health departments do. So we're really expanding our short-term volunteer projects. But then we also have our strike force, which Tricia and Bonnie will talk more about, undergraduate experiential learning, and Masters in Public Health Applied Practice Experience. And we can go through those really briefly in the next slides, but I'm going to keep it very short. So if you have questions on that, feel free to email me later.
My apologies. I'm being told that you can see the presenter piece, and for whatever reason, my screen does not want to let you see the other screen. So my apologies. Just bear with me. I'm just going to fly with it right now because, again, at least you're getting the presentation. So my apologies. For whatever reason, it doesn't want me to switch over, no matter how many times I try.
Tricia, is just an example, especially with the strike force, of how we have to work on things on a fly and we just make it work.
That's right. That's right.
So I just was going to go through these. Do you want to do this, Tricia? Or you want
Nope,
me to-
go for it.
Okay.
Go for it.
So some of the short-term volunteer projects that we've tried to open students up to are things like volunteering at a food bank, assisting at an event, collecting data at an event, which we'll talk about more later, researching policies. So it doesn't necessarily have to be a traditional internship that is 80 or 200 hours. It can be something very short. And then, oops, it's gone again, Tricia. So I might not go in order, but I'll talk about the other things. We also have our traditional undergrad internships, which our students have to complete before they graduate. They have to do 80 hours of a project, but it doesn't have to be as rigorous as what those Masters in Public Health projects have to be. A lot of you may have hosted some of our master's students, and that's pretty rigorous. It requires 200 hours. They have to develop their own project. But for the undergrads, you can really request them and have them come help you with a project that you already have going on. They can assist you with anything that you want. It's very low commitment from you. There's some very brief submissions of how they're doing. That's it. So please be considering bringing in some of these students for those projects. And then there's also the Masters in Public Health ones, which are 200 hours and require a little bit more from their preceptor, but still very, very important for our students. And it is a requirement for them to receive their graduate degree. And then the third section would be the strike force. So I'll turn it over to Tricia and Bonnie for that.
And I'll go ahead and talk about the strike force. Behind me, you can see this big hand with a heart. The students created their own logo. We are technically known as the University of Iowa College of Public Health Strike Force. And a little bit of background of how we became to be in this particular workforce grant. Dean Parker and Lori Walkner were the primary authors of the grant application. And at the last minute, Dean Parker goes, University of Minnesota and Michigan have had these things called a strike force. How about if we ask for money for that too? And so they threw it in, and IDPH was nice enough to give us the money, to which then Lori came to me and said, hey, we've got money to do this thing called a strike force. We're not really sure what it is yet, but you want to do it? To which I said, well, okay, let's try it out. So technically the primary mission of our strike force is to have students prepared so when a public health department or somebody related to public health have an emergent situation and need more resources to help handle or respond, then we are trained and available to do that. However, thank goodness, every day, every week does not include an emergent situation. So we have also, part of our mission is to provide you any public health related organization with additional hands, resources, whatever you need when you don't have enough to accomplish those activities, projects, or processes you need to get done. The biggest example, the most common example so far for us has been helping places with their community health needs assessment surveys, and Jess can talk about that. We do have 10 iPads so that we can load either surveys or get on the internet and supply, be ready to go, be ready with boots on the ground to help you guys get surveys done. Other examples of what we've done so far is to help with vaccination clinics, particularly the monkeypox clinics here in Johnson County. And with Lynn County, we're going to be helping with interviews and survey questionnaires to figure out the NACHO grant for determining how to encourage underserved populations to be willing to get vaccinated. But we've done some very unusual things too. Project Aware, as many of you know, that clean different rivers and things in Iowa. We had a student participate in that. And then Mary Skopek is on the call, so she can talk about what we did for spring break with students at the Lakeside Laboratories in Milford, Iowa, so that our public health students can not only get some hands-on experience, but help them understand the interface between environmental and public health. So that's who we are. The question is, do we provide transportation if we're going far away? Yeah, we can do that. So what we want to do is try to accommodate whoever, whatever we can to help all of you accomplish what you want to accomplish in public health. Tricia, do you have anything to add?
I won't add anything now. I'll probably jump in here after we get through our little PowerPoint and add more stuff about the strike force.
So I already touched a little bit on the undergraduate experiential learning. That's the 80-hour requirement that our students have. So I won't go into too much more detail on that. Other than the fact that we've had a lot of luck with interfacing the strike force with some of our projects, and some of our other guests are going to be talking more about that. But I think that's a really unique approach that we have, where we can provide an intern to work on a project that may be, a little bit more in depth, and then we're able to call in the strike force to help implement that project.
And Mary, who technically runs the MTech field placement program, was not able to join us today. So I told her I would fill in for her and talk a little bit about this project as well. This is separate from work that is done through the College of Public Health and the strike force and the student experiential learning. This really has to do with the Midwest Public Health Training Center. They have a stipend for $3,500 for a student. The purpose of the stipend will support the field placement. This could be a master's level placement. It could be a junior or senior in the undergraduate program, public health program. The time has to be between 175 and 300 hours for the field placement. Obviously, it could be more, but it cannot be less than 175. And the focus must be on socio-environmental factors related to public health needs, and specifically focusing on health equity moving forward. So one of the things is this is kind of an application process that the MTech, Mary, takes applications for. However, one of the things that we ask is that as a local public health agency or nonprofit agency, one of our community partners, that if you have a project that you feel would meet the qualifications of this, we can put it together, we can advertise, we can get a student, you can be a part of the interviewing process to help hire a student that can come in and do that work for you. And this is not a match. They get paid through MTech, not through your department. And so basically they're your kind of team member, but they are paid through the college, and the program is developed to help support capacity for local public health agencies. So at the end of the slideshow, I have Mary's contact information on there, but wanted to make sure everyone was aware of this, that this program does exist. All you have to do is reach out to Mary, say you're looking, you've got a project in mind that really is focusing around health equity, inequality, and that you're looking for a student. And again, depending on the type of project you have, it may or may not land underneath a master level or undergraduate level. But again, this opportunity is also out there for students and for organizations as well. So I told Mary I would make sure I shared that with all of you. I'll cover this real quick. So the connection, so we have an online request form. We advertise, so local public health agencies reach out, or nonprofits can reach out on this website. And it's a short little application form. It pretty much is just tells us what you're looking for, how many hours, what's the project look like. We are trying to take as much burden off of all of you as possible. So if you fill out the form, that information comes to Bonnie Butler, Bonnie Rubin, myself, and Mary. And what we then do is, depending on the project request, we decide on who's that best fit for. And clearly, when someone's filling out some of that information, it becomes very apparent that they need the strike force. And so Bonnie Butler knows to go ahead and just let us run with it. Bonnie Rubin and I run with it. But there's times where it's a much more in-depth request asking for assistance, maybe writing the CHA, writing the CHIP. And that goes beyond the scope of what a strike force member could do. And so then Bonnie works with that organization, Bonnie Butler works with that organization to connect them with either an internship, an undergrad student, or a master's student for that project. So again, we try to really take that burden off of you guys and make that definitive request happen with the best qualified students that we have. We also then, if we don't have a student in mind, or we don't have students that are necessarily popping off the top of our heads who may be interested in that particular problem or project, we put it in our student bulletin. Bonnie puts together a student bulletin that goes out every week, and it's shared with all the College of Public Health students. And so we get responses from there. And then again, depending on the project, if it's a strike force initiative or an experiential learning initiative, they either get directed to Bonnie or they get directed to me. And then other resources that Bonnie has created for our organizations that we work with is an internship resource guide for the employers. It's basically, it's a toolkit for you guys if you need it, kind of things to walk through when you do have students there. When it's an experiential learning, it's a little more time intensive. And so there's a little more information there. When it's the strike force coming in, one of the lessons learned that we had was we need a little checklist that is created for the organization that will be going in and assisting. So we don't have as much of an intense manual, but we have toolkits or tools that we provide to our agency that we'll be working with, just so they have, you don't have to, we're trying to make it as easy and as simple as possible, and to take that extra work off your plate so we can provide that support to you. Bonnie, Mary, and I, though, will say, please do not get overwhelmed with the form. If it's just easier to shoot us an email and say, hey, this is what we're looking at, we want to make this as easy as possible. So at the end of the slideshow, I have our contact information, so feel free. But this is a form online. You'll see it advertised a lot. So feel free to use that or share it with others who may be needing support or student support. And with that, I'm going to leave this up so you have time to review it, write down anything you need. But we'll go ahead and kick it off. Mary, I'll start with you since you had a spring break. I'll let you start off kind of your experience working with the team here and the students that came and visited you during the spring break time.
Sure. Well, thanks, Tricia. I'm Mary Skopek. I'm the executive director at Iowa Lakeside Laboratory. We are located on the west shore of West Okoboji in Dickinson County, way up north in Northwest Iowa. So a spring break trip to Northwest Iowa can be a little chilly. We had a small but mighty group. I think we had 4 strike force participants that came up, and we worked pretty closely. So Iowa Lakeside Laboratory is an Iowa Board of Regents campus. We work closely with the Regents institutions, We do water quality testing, we do K-12 programming, but we also work, closely with our Department of Public Health folks over at Dickinson County. And so when Bonnie Rubin reached out to me about having a group here, of course, I was thrilled. With the lakes, we have lots of questions about public health, and my background is environmental science. So of course, we're always curious in how healthy it is to be outside and whether or not we have issues with, say, beach water quality or lake drinking water quality and those sorts of things. So when the team came up, we put together a kind of a tour of having them, look at environmental science here. The State Hygienic Laboratory has an outpost. So they got to see sort of how the State Hygienic Laboratory operates up here in Northwest Iowa. We did a little bit of testing of water. Again, it was cold. So we talked a little bit about, the nutrient levels and bacteria levels. And then they spent some time with Katie Burke, who is the Dickinson County Public Health Director, also based in the hospital here, the Lakes Regional Hospital. One of the things I think that was really phenomenal from that was, we got to sort of meet folks, have some really great conversations with the students, and sort of pick their brains about things that they were interested in. One of the students is from India. He's a dentist by training and is working, I think, his master's of public health. He reached out to us after the event and said, hey, I'm interested in coming back in the summer. So we had Krishna Akandi come here to Lakeside in July, and he split his time between the Dickinson County Public Health folks. In their CHA, they realized that dental health and access to dental health is pretty difficult up here. I think there's like 19 counties in Northwest Iowa where there isn't a dentist that takes Medicaid payments. And so access to dental health is really pretty severe for folks. And so he was working with the public health entities here to start to develop some ideas about how we could get folks access to dental health and maybe bring some dentists up and do some clinics. So that was great. And then he split his time with me, and he wanted to look at bacteria. And so we have lots of state-owned beaches that have regular testing on bacteria levels at beaches, but the city and county beaches do not have testing. And so he jumped in and started doing testing at some of the city beaches that are some of the most popular beaches, actually. Found levels of bacteria that were fairly high, which led him down a path of looking at pathogenic bacteria, which he also found up here. So it's been a really eye-opening experience for us to have him come in for less than a month and really do some phenomenal things that have got us thinking about what we need to be doing next to really help protect public health. So working with Christian was really fantastic and really set up through the strike force visit that happened in spring break. And so we're going to open our doors in the future to future teams to come up and interact with us and find some cool things for us all to do together. So with that, I'm just going to turn it back to you, Tricia.
Awesome. Thanks, Mary. Jess, I'm going to turn it over to you so you can share your experience working with our students as well. You're muted, Jess.
My name is Jess Wagner. I am here's Maggie, is the Fayette County Public Health Coordinator and with the program that we worked with Upper Iowa or University of Iowa is we are a hospital-based public health. Our total population in our Northeast Iowa County is 20,000. So my FTE is about 32 hours a week as a coordinator. And I also serve as the nurse, one of the nurses for the county. So we are a very small public health department. And I think where I recognized that I needed help was through the opportunity and the use of students. So I first have heard of this at one of our regional public health meetings. And I've worked with students before from the University of Iowa through the College of Nursing. So when it was a public health opportunity, I wanted to jump on board right away. So I created a menu of matches of just different programs that I thought I needed help with and what staff member in my organization could help, but also what is the opportunity for the students that I was looking for. We went through a process with Tricia and Bonnie and what we wanted. I created a plan on a page or a program on a page of just the different menus of matches, because sometimes I recognize sometimes in our rural county public health is that those programs look a lot different than in some of the urban larger counties. And so created those plan on a page so everybody was on the same page, so we could know, what was the expectations, what were the resources. It really did help me organize my thought process as a coordinator and kind of allow the students to know what the next step process would be. We went through the interviews. We had an opportunity to interview some students for our project. The project that we ended up picking was having, first of all, an intern help us with our CHA. We recognized that we needed to redo the whole thing. And so that was an opportunity. We have an intern that has started that process from the beginning with me and is continuing to still work with me to help write our CHA and our CHIP. And then we had the interview process, selected that intern, and then we realized too that we could also utilize the strike team to help administer the assessment. And once we had our students, we went through the background check process through our hospital-based organization. And so I had the undergrad intern and the strike team. I really felt both of them together complemented each other. It was nice to have the intern working on the program for the long-term part of that and working with me on that. I do check in with the intern weekly. We meet via Zoom just to kind of what's the next steps, kind of reviewing his work. And then also, you get the student perspectives in that. I think at one point when we were meeting, one of the things that I appreciate about students is they trying to have an environment where they feel like they can bring their ideas to the process of change through some of these programs. And so I would just remember one of the strike team leader of our strike team, she had just gone through a survey class. And so she was able to provide input not only for us locally in public health, but also for her fellow intern about a process change for taking surveys for people. And we were able to change a little bit of our survey and implement that process right away. And I really felt like we got some better survey results and participation because of that suggestion. The, being a preceptor at a local public health department, I'm not going to lie, it does take a lot more time and effort than you just doing it. But I also recognize that a lot of these interns, in 6 months to a year or a couple of years, they could be the students that are applying for the jobs that we post at our public health department. So it's even better if we get to work with them early and help work with that succession planning or even the hiring process. I think it gives them a real time, real hands-on experience. This may be only one deadline that they have to meet, but then understand the different compounding deadlines that you have at a local public health level. We had the strike team come to our county fair. It was towards the end of July. It was probably the hottest day that we ever could possibly have, and the building did not have air conditioning that day, and it was a health expo with our hospital had sponsored it. And it was a different format of health expo that we had done in the past. So we had that factor going, that it was different. We had the factor that we had the strike team, the intern did come, and some of the instructors, I think Tricia and Bonnie came too. And so, and the other factor was that I was not going to be there that day because my daughter was showing cattle and we were busy doing that with her for 4-H. So a lot of different factors. There's always some things for communication that you're like, oh, we should have done that better, or the things that having my intern there who developed the survey, having some like in real time change options for the survey. We used like a Google form, so that was really beneficial. It was kind of fun. They didn't know, well, they might have known that I was I was watching my phone and seeing how many surveys came in because I could log on to the Google Forms. And by the time we got done showing and I went in, I said, wow, you guys did such a great job. You had so many. And they're like, how did you know that? So it was kind of fun to watch that progress and share that excitement with them. I think, sometimes when you work with students, coaching them, not only to gain the confidence, but coaching them on the quality of end result that you want. You have to have the confidence in yourself as a coordinator that you can coach them to the end result that you want. So if, mid part of the project, it's not going how you want, it's your job as the professional to help coach them to get them to that quality end result and not allow them to have a mediocre project. You really want, if they were your employee, that's what you would expect, and kind of helping them learn and process so that they can get to that level. And like I said, too, I think the biggest thing for me, we were in transition with staffing as well during this process, trying to juggle everything, but it was very helpful to have the additional input, extra eyes on the survey. And also to our intern, it was a great fit, I felt, because he had a background in journalism. So we're actually hopefully going to get a CHIP report or a CHA that is kind of a journalism background instead of a data background, but still including that data that we need. And, like I said, just providing that hands-on learning for the students and knowing that they could potentially be they will be our next workforce, and hopefully keeping them in Iowa. So.
Awesome. Thanks, Jess. I'm going to stop sharing. So I guess one of the things that Sharon indicated before, I think we've taken up some time to share kind of what information about the strike force, about the students, some of the opportunities, some of our partners who have actually used our students. Questions. I want to open it up and take questions. All you need to do, feel free, you don't need to turn your camera on if you don't want to, but you can unmute yourself and ask any questions that you have, or if you want to raise your hand or let me know or put something in the chat.
And as everybody's getting ready to do that, where did the name come from? Basically from Dean Parker. She said, we should have a strike force. And then I did some research for University of Michigan. They have what they call a public health action team. And University of Minnesota also has a team, but I have to honestly say, I don't remember their name. Just so you know, the students who join the strike force, they are expected to complete the incident command system trainings of 100, 200, and 800. We also have a HIPAA compliance online course that we want them to take. And once they complete all of that and their student authorization form that has all the media releases and things like that, they get their t-shirt. So there's some incentive to get all of that done. So we want to make sure they have a whole lot of trainings and backgrounds even before they come out to your places. So we're pretty excited about that.
I was just gonna, can you guys hear me?
Yes.
Okay. I was just gonna follow up with my question about the name. I just, strike force to me sounds a little controversial, I guess. The other names that you said, like the University of Michigan, there's more like action, the word action was in it. To me, that sounds like more positive. So I was just curious where it came from. Like when I think of strike force, I would not think of all these awesome students and all these really cool projects helping out the community. I kind of think of the opposite. So I just wanted to say that. But great program. This is very great. Thank you.
Thank you. Yeah, we've heard some feedback from the College of Public Health faculty also about, it sounds rather like military. But the name also is based on what CDC does too, and Homeland Security Defense, and the fact that the CDC has several strike teams that respond. One of the biggest ones lately was with the COVID response. But that's how they usually stand up their immediate response and short-term response groups. They call them strike teams or the strike force teams. So there is that historical background with the CDC. Our first project was actually with the State Hygienic Laboratory when there was that COVID surge, and they asked if the students could help them with preparing test kits, processing test kits when they came in. So we had about 48 students who responded to that request. And that's what really got us on track of what we needed to do and how we needed to respond. But yeah, totally get your question. And there you go.
I had a question about, I guess, credentialing for the preceptors. So I know for the practicum students, the students get matched up with like someone who's qualified. So my EPI students go to one of our EPI people. Is that a requirement for your other levels of like internship, the strike force?
It is not. I'm really glad that you brought that up. So it's much less rigorous to be the supervisor of an undergrad. It can even be a graduate student. So if you have a graduate student doing their internship in your organization and you want to assign them an intern to help with that, they can be the supervisor. And so anybody in your organization also could do it.
Perfect. Thank you.
Yes.
I would say when we worked with Jess, so Jess had an intern, and then because we knew that the collecting the survey and the data was going to be a larger project, we assigned a strike force member to kind of be that lead. So that individual participated and worked with the intern that Jess had. So McKenna and Sebastian worked together. McKenna was part of the strike force, and then McKenna would participate in some of the meetings as well, planning the data collection day. And so then she brought that information back, shared it with the strike force team. So the day that we were, we actually all traveled together in a university van. And so on the way up there, McKenna filled us all in, shared her what had all been discussed, how we were going to address the day, how we were going to kind of plan out and be at the fair. So it was a really great partnership to even have two students working. So some of that also took the pressure off of Jess, because Sebastian could work directly with McKenna. And so Jess that'd free up more of her time to spend with Sebastian, her actual intern, who was there long-term, versus the strike force that pretty much came in for the day, helped collect all the data, got all the information, and then left. Like that's kind of the premise of the strike force, is to really go in when there's a short-term project that needs a high capacity for work to be done. So it was a great partnership. So yeah, it was something when Bonnie Butler and I were talking about some of this, being able to have staff or have students not have to be necessarily aligned with somebody with either a master's in public health or epidemiology, to actually be able to really provide that support. Because we know that was a barrier. Bonnie and I both coming from local public health agencies, as you know, it was something that we knew was an issue. So we wanted to make sure that that's not a barrier for folks moving forward.
Yeah. And I'd like to speak to Amy's question too, because, if this program would require an EPI background, I mean, I have that, but in our local small public health department, we don't have an EPI like what Lynn County does. So, that kind of really doesn't even allow us to apply for some of those internships that have the specified degrees, even though in our small local public health, we are that local EPI, we are that nurse that does VFC, we are the, all the other different programs, preparedness and everything like that. So I really did appreciate that those requirements weren't there, because I felt like that barrier was dropped and we got a really good project outcome from this.
Yeah, well, I really appreciate it, from even being able to build my team up and have them start doing some leadership. And especially if I do have a student who's with us for a long term, that adds to their resume. So I really appreciate that aspect too.
So speaking of the students, Bonnie, can you give us some idea, or Tricia, some idea of the feedback that you've gotten from these awesome experiences with Mary or Jess, or even at the State Hygienic Lab, and how it's impacted their view on public health and the workforce?
I'll take a stab first. So far, the feedback we've gotten from all of our students has been very positive. They really appreciate the opportunity to actually do stuff. And all of them have said that they've learned so much, not just from actually doing the activity, but the interactions and networking. They've had the opportunity with different public health and environmental health professionals and other students who are in different fields. For example, working on the monkeypox vaccine clinics, our students have had interactions, the opportunity to work with the community health nursing students from the College of Nursing. And then with other students from other departments or other schools. So I think for us, it has been really gratifying how much the students have appreciated, how much they've learned, and how willing all of our partners have been to mentor and impart their knowledge to help them be really good public health professionals.
I'll speak up. So one of the things I think with the students' feedback, so they helped one of our counties, Johnson County, to do they were doing a CASPER, which was it's kind of like a community needs assessment, but more on an emergency response type mission. And several of our students who obviously, live here in Johnson County, go to school here, have been here for several years. One of the comments they came back was they went to parts of the county that they had never seen before, and saw and got to interact with community members that they may have never interacted with before. So it gave them an even more enriched experience to be able to, when we talk about health equity and we talk about access and we talk about some of the issues that we've learned from COVID, they really got some hands-on experience of what that's like and got to talk to community members who were impacted by some of that. So it was a very good experience for them. And again, I think two of them said, Tricia, I have lived here for 4 years and I have never been to that part of Johnson County. So it was good for them to see that it's not just Iowa City. Johnson County is not just Iowa City. There's a whole big area of Johnson County that they had not been exposed to before.
Tricia, I kind of want to piggyback on that. I want to make sure that it's really clear that every county public health department in Iowa is able to request students for these projects. And that's really one of our goals, is to kind of get our students outside of the boundaries of just these urban counties that are near us. And so we've been talking a lot about it in class, even talking about the fact that if you really want to know what local public health does, go to a rural county, because they're doing 5 or 6 different programs by one person. So we definitely want to continue to partner with the large counties as well. But I think we've done a good job of that in the past. And now we're really trying to reach out and make sure that every county realizes that they are eligible and welcome and encouraged to request this.
And I just want to emphasize what Bonnie Butler said, no matter where you are in the state, if you need our help, if you want our help, we will make a huge effort to make sure we can accommodate it no matter where you are. Even if it's clear on the northwest side of the state, we will make sure that we can help you out.
And I think that's the other beauty of this, is being able to, within the strike force at least, we can, if it's for a day or two, we can all pile in a car and ride together. But if it's a long term, we've come so far with Zoom and meetings and doing things virtually that the students also, if you have a project that they don't technically need to be on site for, but you've thought, oh, you're too far away, but you can actually have meetings in that, definitely get a hold of us. I think the students are excited. And one thing I will tell you, the students have also shared, not only in the class that I teach, but also through the strike force, they like going to rural Iowa. They like going to the smaller communities because they, that's not the exposure they get every day, right? Like they're in Iowa City, so they kind of see some of the urban issues that are here. They don't get to see what's going on in rural Iowa. So they want to have that exposure and understand how that impacts public health. So again, I encourage you, no matter where you're located, to reach out. If you've got a project that we can assist, whether it's a strike force for a day or two or a longer term project, we want to help. We want to get you connected and be able to provide that support to you, but it also gives our students a wonderful opportunity to see the rest of the world.
And just to clarify, ladies, this also means that if I work in a public health, like-minded nonprofit land, I can also utilize a strike force. I know at IPHA we did, but I also know there's other individuals on this call that don't necessarily work at a local public health department, but are ingrained into public health. So they too, correct, ladies, they too can reach out to you all and say, hey, I have a project, or I have an idea, or I have a need.
Absolutely. Nonprofit, corporate, public health, hospital-based public health, large, small. We want to hear from you.
And just to give you an idea, I mean, we're working with United Way of Iowa to be able to help them with things. We're working on all of our table-to-table organizations so that the students can have the opportunity to work with issues related to food insecurity. And I see Pam's on the call, and we're more than happy to work with other public health departments and public health students that we can actually increase the force and power of what we do across the state.
Other questions? And Drew, thanks for the shout out. Appreciate that.
Well, I will tell you from a personal experience, it's easy, it's seamless. It's as simple as I sent an email to Bonnie and said I had a crazy idea, we needed help. I got an answer within 24 hours. Bonnie put something in a newsletter, and by Monday afternoon, I had 35 interested students that wanted to be part of this program. And so it was a lovely problem to have 35 students interested in my little project that I needed done. And it also gave me the opportunity to do some interviewing, but it also gave the students an opportunity as I provided feedback to them in regards to what their resume should look like. And don't assume that just because they are a student that they get that golden pass that they are a student, because they also need to present themselves in a professional manner. So it gave me an opportunity to provide some feedback to a couple of the students by saying, just double check your spelling and your grammar and little things that we know are a big deal when you're professional. And it's literally the make or break of actually getting an interview when we're moving forward. So the other thing, as you all know, we have a student networking group. And the purpose of the student networking group for IPHA is to work with academia and local public health and nonprofits so that we can have these matches and exchange of ideas for students so that they get placed and they're not getting to go to a place that is not the best choice for them. So that is awesome. Catherine has a question. If you all at the U would like to answer that one. And it's in the chat. Can you all read that, or do you want me to read it to you all?
I've got it. I can see that. The student's probably working with Jeannie to develop their project. So I think they're responsible for coming up with that project proposal and running it past her and then presenting it to you. I think you're probably welcome to be as involved as you would like to be, but it shouldn't really rest on your shoulders to develop that. I hope that answers the question.
other questions?
And I just wanted to let you guys know, we do tabletop exercises to practice instant command and other incidents. But if you guys are doing any sort of functional or full-scale exercises, you need either victims or facilitators or volunteers, let us know, and our students would be happy to help.
I wanted to have a chance to mention one more thing that I keep forgetting because it's brand new. Within the last couple of weeks, we developed a stipend for students. So I know a lot of small public health departments especially resist asking for assistance because they're concerned that they can't compensate the students. And so we really want every county to have the opportunity and every student to be able to take whatever opportunity that they would like to try out, regardless of their financial ability. So we have stipends for between $1,000 and $3,000, depending on the amount of time that they're devoting to the project. So don't let that hold you back from requesting a student.
I would say right now we have approximately 33 active Strike Force team members that I get to track all of their training and all the things that they get to sign up for and all of the projects, which is really exciting. And it's awesome to see them get excited when I post something new of a project that they've been requested to come in and assist. So again, we've got some really ambitious students. And I think one of the things that's kind of exciting about this as well is that, you know, some of the students are graduating and we're giving them some great experience, whether it's for more of a long-term project or even the short-term project. The Strike Force students are graduating with their ICS classes already done, certificates in hand, which I know is a huge thing for a lot of local public health agencies. They are have already taken a HIPAA compliant certification. We're getting ready to go through and set up some CPR classes. So we also do they're more optional trainings, but there's additional training that we're offering to the Strike Force as well. And this next month in October, I think the Strike Force will be participating in a de-escalation type simulation where they can learn how to deal with angry public. So I think if anything in public health that we've learned this last year is being able to diffuse a hostile situation. So that is something that we talked about. I talked about in class, but we also talked about with the Strike Force. So they're coming with hopefully some experience, but they're coming with some basic needs of local public health agencies. And then as we see students graduate, we're also then getting new students in. So I kind of like that it's it's constantly growing, but we're shipping others off into the real world with hopefully some really good experience, and we'll be able to work with a lot of you as we move forward. So Sharon, thank you for inviting us to share about what we're doing here at the college. I really appreciate being invited and to share about the Strike Force and the experiential service or experiential the time that students can come, I can't even think of the word today, that can come and spend and help and assist local public health agencies. Bonnie Butler, do you have anything else you want to add?
I think you covered it very well. I just would encourage anybody who has additional questions to reach out to any of us, and we'll make sure you get to the right person.
Absolutely.
And I just want to say thank you for bearing with me as I watch two little girls. But yes, absolutely. When you think of something and you say, hey, I could use some more people, or I could use a student who could help me do this, be sure to reach out, be sure to go to our website, find the project application, because we're from the university and we're here to help.
This has
We
been
really mean it.
right. This has been awesome. And I've appreciated Bonnie and Tricia, you taking time out of your busy day and highlighting this awesome projects that you've all had. Jess and Mary, thank you for talking about your different projects that the students have done and the impact that they're making, not only in your communities, but also lifting up your staff and helping lift up that burden that you all have on a daily basis, which I know is great. And it's awesome to see that the students can make an impact on your decreasing your workload. This has been so insightful and I've really enjoyed it. And I hope that everyone else that has been on has enjoyed it as well. I put the evaluation in the chat a long time ago, so hopefully you'll take a couple seconds to fill that out. Next month's topic is from Dr. Greg Welk. Dr. Welk is from Iowa State University, and he's going to be talking about the U-Turn program. As always, these Lunch and Learns are driven by you and your guys' ideas and what you want to learn about and hear about. So if you have any other ideas, we still have a couple of openings in the spring. Feel free to shoot me an email. My email is sharon@iowapha.org. If you can't remember that, just go on the IPHA website. You'll see my face. Not my option to have my photo on there, but it is, and you can click on that. And again, thank you. I also want to personally thank each and every one of you that work in public health. I know it has been an extremely difficult last 2.5 years. We've learned a lot. We've grown a lot. Public health has definitely become a closer knit community. And if someone hasn't told you thank you yet today, let me be the one to tell you thank you. And I appreciate your hard work that you do day in and day out. And thank you, thank you, thank you. So with that, I want you to enjoy the rest of your day, enjoy your weekend, and take care of yourself and be well. Good job, Tricia.
Thank you. Do you need anything else?
I don't. You did well. And I think I loved the different stories from Mary and Jess. And I love that Jess was honest and said some of the successes and barriers. And as I said yesterday, I just wish this one to have been on a day that local public health administrators had to be in their required meeting otherwise, but it'll be on YouTube. So
Awesome.
it'll be
Well,
great.
ma'am, thank you so much for the opportunity. Have a fantastic day.
You do the same. We'll talk soon.
All right. Bye.
Bye.